Hello, Dr. Nardone here. It is Saturday, April 25th, 2020. Today we're going to talk about some sun science. You may have heard the words ultraviolet light and UV light in relationship to the coronavirus recently. Well, today I'd like to talk about sunlight, sunshine, and in particular UV light in relation to the all-important vitamin D. Many of you may not know this, but in order for your bodies to manufacture vitamin D, you absolutely need sunlight. And more specifically, you need UV rays from the sun to hit your skin, to contact your skin, and start the process of creating what's called pre-vitamin D. That pre-vitamin D gets into your body and undergoes more chemical reactions and eventually becomes active vitamin D. Vitamin D has multiple roles in your body. The most common of which we know is the mineralization of bone because vitamin D helps to regulate calcium. So it's important for bone health. However, even beyond that now, we are finding that vitamin D plays roles in protein synthesis, in normal cell development, and also in your immune system. Think about that, immune system. We're hearing a lot about immunity, trying to boost immunity, trying to get immunity to this COVID-19 virus, trying to check immunity on blood tests, etc. So having an intact immune system is important always, and even more so now. Many of us have been advised to stay home, to stay indoors, so it is not unlikely that we are somewhat vitamin D, at least have an insufficiency of vitamin D, or maybe even be deficient in vitamin D. I've had many patients over the many years I've been a physician who will have told me, doctor, I'm so tired, or I feel depressed, or I have no energy, even my hair's falling out, my skin doesn't look right. And I will say, well, let's check your vitamin D levels. Amongst other things we'll check, but oftentimes they have low vitamin D. And this is very treatable. There's over-the-counter supplements. Your physician can also prescribe higher doses. The recommended daily allowance for adults is about 600 international units. And for people over 70, it's about 800 international units. But if you have a deficiency or an insufficiency, you may need more. So you can talk to your healthcare provider about this. It's very easy to check your levels. It's just a blood test and see what they recommend. And you certainly can use a telehealth visit to discuss. However, in that vein, I do want to mention that it is so important in the interim that we do get some sunlight. Try to get outside, exercise, get sunlight whenever you can. Of course, observing all of the precautions put in place to protect yourself or others from the virus. But the benefits of such activities is far-reaching. And remember, keep your faith stronger than your fears. Have a sunny Saturday, and goodbye.